Well, as we all know, the COVID-19 pandemic has touched many aspects of our lives and also prompted a renewed community focus on the welfare and well-being of Australians. Joining me live now is Matthew James. He's the Deputy CEO of the Australian Institute of Health and Welfare. Appreciate your time. Well-being, more than ever before, probably depends right now on where you live. If you're in New South Wales or Victoria or the ACT, you're probably not living the dream at the moment. What does this latest report tell us about just how satisfied Australians are broadly with life right now, how our mental health is tracking, how loneliness plays into that?
Sure, thanks. Good afternoon. One of the things that's characterised COVID is how quickly things have changed. So life satisfaction in Australia has shown some quite dramatic changes since the onset of COVID. Normally, life satisfaction doesn't change very much from one year to the next. So what we're seeing at the moment is life satisfaction worsened in April last year. It had started to recover by January and April this year, but it's worsened again, and we're back down to the low points that we were in April last year when we had that initial lockdown. And life satisfaction's worse in Sydney and Melbourne. Regarding psychological distress, if you look at the percentage of Australians in severe psychological distress, it's higher than it was prior to the COVID-19 pandemic. There's also a distinct pattern by age. That is, younger people, particularly those 18 to 24, have higher levels of average psychological distress than they did prior to COVID. Whereas if you look at people aged 45 and above, they're even little change, or in some cases actually improved since the start of COVID or prior to COVID. Loneliness has also increased, and the loneliness tends to track when we have lockdowns. So where you have lockdowns in one jurisdiction, loneliness tends to get worse. So there's been increases in loneliness again from April to August this year.
We know that calls to the various helplines have really spiked throughout the pandemic, but are we actually losing more people to suicide and self-harm? Are the rates fleshing that out?
No, prior to the onset of COVID, there was a lot of predictions that suicide rates would fall in Australia and in other OECD countries. That luckily hasn't been the case, and that's not restricted to Australia. But if you look at the published data from the suicide registers, and those registers provide, very timely data on suspected suicide, we haven't seen an increase in suicide rates overall in Australia, and that's evident in Queensland, Victoria and New South Wales in the published data.
There's also been a lot of concern about education levels, parents particularly really worried about that shift to online learning in some areas, with so many kids just losing so much of that face-to-face learning time. How has education been impacted? Is it too early for us to really get a grip on that?
Well, if you look at the NAPLAN results for this year, they don't seem to have been affected much, but that's probably one you want to look for longer term effects. The other thing is, we partnered with the ANU in the survey called ANU Poll, and we looked at levels of psychological distress and things like that. And if you actually look at, there was an increase in the average level of psychological distress from April to August this year, and it seems like there's a particular increase, particularly for women who are, doing more at home and they're still working, and some of that might be related to homeschooling. So homeschooling and trying to combine work with homeschooling can be stressful itself.
Yeah, everyone's looking forward to getting kids back into the classroom, no doubt about that. Matthew James, appreciate you joining us. Thank you so much for your time.
Thank you.